So we're talking about free market solutions to boost the health of Europeans across the continent. We all know that across the continent there is this push from many areas of public health to have increasingly interventionist policies in the public health arena. We know that the World Health Organization and indeed the European Union itself is encouraging member states to introduce more interventionist policies across the governments. We know that in the UK, for example, we are currently seeing the introduction of a generational tobacco ban, where anybody born after the 1st of January 2009 will never be able to legally buy tobacco products. We also know that across the European Union, various different products are being banned, and we know that, for example, advertising for junk food is also being restricted past certain hours. So, it has never been more important than to discuss free market solutions to healthcare problems across the continent. And to discuss this very important topic, I am absolutely delighted to be joined by my wonderful star panel. We have Julian Braithwaite. Julian is currently the CEO of the International Alliance for Responsible Drinking, which brings together the leading beer, wine, and spirits companies around the world to tackle the harmful consumption of alcohol and promote moderation. The 30 years in the public sector, including 6 years as the UK's ambassador to the World Health Organization and other international organizations in Geneva. We also have David Zaruk. David is an environmental health risk governance analyst that specializes in EU policy debates. Up until 2006, he worked 12 years in chemicals issue management for Solvay, Sevic, and Burson Marsteller. And until 2022, David was a professor in communications, public relations, lobbying, and marketing at Vesalius College. He also might be well known to many of you for his excellent blog, The Risk Monger. I would definitely recommend checking it out if you haven't already. And last but certainly not least, we have the wonderful Sebastian Stodolak. Sebastian is the Vice President of the Warsaw Enterprise Institute, economic columnist for Dziennik Gazet Prawna, I don't think I've pronounced that very well, and the graduate of the Faculty of Philosophy at the University of Warsaw and postgraduate studies in finance and monetary policy at the Polish Academy of Sciences. I'd also like to let you all know that we do have beer outside if you would like one. Okay, without further ado, we're going to hear from each of our panelists for about 3 minutes each, and then we're going to open it up to a discussion and, of course, allow all of you wonderful people in the audience to have your say. Without further ado, would you like to start us off?
Thank you so much. Thank you for being here at such a late time on Sunday afternoon. That's an achievement for us, actually. So as a poll used to do, I started with complaining. Our healthcare system is getting worse and worse. We are being ranked lower and lower in all those international comparisons of healthcare systems. Basically, it's nationalized. So let me give you some, let's say, indicators of how bad it is. We are almost 5 years below OECD average when it comes to life expectancy. So the OECD average is around 78, 79. Polish average life expectancy for a whole population is around 74 for the whole population. Of course, women live much longer than men, obviously. I would say a terrible indicator for Poland is the excess deaths, especially during the pandemic. We were in the top when it comes to this. We have almost over 150,000 excess deaths during this period, unnecessary deaths. Let me underline this. These deaths were the reason of how bad it is when it comes to our healthcare. So this is how it looks like right now. Maybe one more indicator, waiting line. For example, in order to get a common surgery, you need to wait 250 days on average in Poland, while, for example, in Holland it is 50 days. So that's a kind of a striking difference. So to keep my answer short, because I can only speak about Polish system, but what I'm intending to say is that we need to use some experiences from other countries when it comes to restructuring our healthcare system. We need to input some competition among health insurers. So those of you who are not from Poland are not familiar with our system. We have a single payer system. So we don't have any kind of competition between the insurers. Of course, we have private ones, but this is not a proper competition since you have to pay in order to use their services. You need to still pay the official contribution to the state insurer. So this is first thing I'd like to say needs to be changed. There are cases, there are examples from Europe where you have many companies competing for patients. For example, already mentioned Netherlands, Holland is such a country. The second thing is co-payments. And contrary to what one might think, this is quite a popular solution among OECD countries. Over 22 of all the countries have co-payments, at least according to Fraser Institute. We don't have any co-payments when it comes to the visits in our hospital or in first in so-called family doctors or first contact doctors. So that also needs to be addressed. Even a small amount of money required to be paid upfront will reduce the waiting lines significantly. So I think those two mechanisms could really help our healthcare system. But in the end, I would say privatizing the insurers, like a full-fledged privatization of the health insurance market would be necessary. So we don't really need to have a national state-owned insurer. So this is, I think, something I'd like to address here.
Excellent stuff. You definitely not be able to say that over in the UK. They would absolutely kill you if you said you would like to see a privatization of the NHS. Although I'm glad that this wonderful venue allows us to actually discuss these ideas very freely. All right, would you like to go next?
Reem, thank you very much. Thank you very much for inviting me to join this panel as well. And we've just heard from Sebastian about a sort of national perspective on this issue of how the free market can play a role in supporting health for Europeans. I'm going to come at it from a different angle. My name's Julian Braithwaite. I'm the Chief Executive of the International Alliance for Responsible Drinking, and I'm going to talk a bit about alcohol and health, perhaps unsurprisingly, but also in the European context. The harmful consumption of alcohol is a serious public health problem. It leads to non-communicable diseases. Those, according to the World Health Organization, kill 2.6 million people a year. So there's a serious problem, or at least alcohol is related to that. And within Europe, the figures are a bit less than 1 million, serious numbers from the World Health Organization. My organization was set up by the 13 leading companies in the sector globally in order to support tackling this problem through leveraging the power of the private sector, of the free market in support of that goal. I want to sort of say three things, I think. One is that the global strategy, which is a UN strategy, it's a UN strategy to tackle the harmful consumption of alcohol, harmful use of alcohol, that actually does leverage the private sector through what it calls a whole-of-society approach, which is a sort of form of multi-stakeholder approach that brings civil society, government, the private sector together in order to tackle this problem. And my companies have done that in two particular ways. One is by supporting the principle of informed choice, that adults, moderate drinkers should have the information that allows them to consume moderately and therefore relatively safely. And they do that through by leveraging their own marketing and advertising budgets to promote responsible consumption, through labeling, et cetera, et cetera. So they provide information so that people can make informed choices. They also provide products that allow people to make informed choices, including low alcohol beers and zero alcohol beers, which has become a great innovation over the last few years. Secondly, these companies support interventions to prevent the harmful consumption of alcohol. So underage drinking is something that shouldn't be a choice, and the industry supports actions to tackle that, including through some very innovative work with digital marketing agencies, Google, Meta, other platforms to restrict and prevent the sale of alcohol to minors online and the advertising online. So those, and they support statutory interventions in terms of legal purchase ages, et cetera, et cetera. The second thing I'm going to say is actually that strategy is working. It's not often you can say that about a UN strategy, but if you think of what's the key indicator of harmful consumption? What are we really talking about here in terms of health? You want to reduce the number of people who are being disabled or dying because of causes linked to alcohol. And the latest WHO data shows that since 2010, that number has come down globally by 20%, which is a striking improvement. And within Europe, it's come down even further by 29%. So this is a strategy that is working. It's leveraging the private sector. It's a whole of society approach. It's set globally through a UN framework that involves obviously the World Health Organization, and it is working. So the third thing I'm going to say, which is a bit counterintuitive, which is there is a campaign to change this strategy and to shift the focus from tackling the harmful use of alcohol to just tackling the use of alcohol altogether, and not to leverage the private sector, but actually to exclude it. We might get into why that is, but for my companies, one of the things that we do, need to do, is to demonstrate the impact that private sector action can have in delivering the results that the WHO is demonstrating through its own data. So, we want to get the focus on what's working, because things are working, not everywhere universally, but things are working. In Europe, there has been significant progress. We want to get the focus on what's working and what are the policies that are working, because we do think that if we do that, we'll be able to demonstrate that the private sector has played. But there is a debate, and we'll come back to that, I'm sure.
Excellent. Thank you so much, Julian. Evidence-based policymaking is certainly important and something we'll definitely be discussing throughout this panel. And last but certainly not least, we'll have the next 3 minutes.
Okay, thank you very much. I'm not going to talk about the free market's solutions to health issues, because quite simply, if you have a problem, the free market is going to solve it. I'd rather talk about the obstacles to the free market being allowed to solve the problems, because, and this will probably overlap to what Julian's talking about as well. I'll talk about obesity, I guess, so we can get a balance here. But 10, 11 years ago, I wrote an article called "Who Made Me Fat?" And it I was 95 kilos at the time, and I was angry. Somebody made me fat. It couldn't possibly be me. I could blame my wife, maybe blame my children, I don't know. But anyway, the point was I was fat and I was angry. And there was a lot of attacks on the food industry that they're not only feeding us sugar and chemicals and all of that, but on top of that, their marketing is making it so impossible. They're making us all into food or junk food addicts. And so it's very easy to take a complex problem like obesity and turn it into one simple point: just get rid of industry. And the point here is, I didn't blame industry. I lost 20 kilos, and I thanked industry for that, because industry also provides any solutions that I needed, and not just talking about high fiber food or sporting facilities, or now we can talk about Ozempic. And so the idea is that the free market will provide solutions, but there's that undertone. We talked about this a bit in the previous session here as well, if you were here, that there's a very strong movement against industry, that we have to stop industry. And I'll just maybe introduce the subject on what the WHO has recently done. There was a group in the Lancet, actually about 4 or 5 years ago, that talked about commercial determinants on health. And their view is that the reason we have health problems, including cancer, heart disease, diabetes, is because of industry. These diseases wouldn't exist, apparently, if we didn't have industry. And so their view, and the WHO picked it up in a report earlier this year, and well, they brought in their non-communicable disease division, so it's commercial determinants on non-communicable diseases, I think is the full title. And their view, quite simply, is that you cannot trust industry. You cannot trust the free market. We have to actually control them. And we have to do it severely, which means we have to cut them out completely, like we did tobacco before. They denormalized the tobacco industry, no longer allowed to be allowed in policy debates, no longer allowed to be working at all with any policymakers, can't lobby, can't do anything. Well, it's not just that, but other industries. Now, the drinks industry may think they're the next big tobacco, according to the list, but to be quite honest, they've got everyone on that list. They've got the pharmaceutical industry. So they're talking about Mpox. But the regional director to the WHO from Africa could not talk to anyone from Bavaria, Bavarian Nordic, sorry. So you begin to see, how can the WHO not be allowed to speak to the pharmaceutical industry about possible solutions? Okay, to talk about plastics, you can talk about baby formula, which the WHO did refer to as the next tobacco. So we're seeing a very strong view that they want all members of the WHO to isolate, exclude, denormalize all industry, which means the free market may not be able to find solutions for health in the same way.
Thank you. That's really, really interesting. I think what's interesting about this particular debate, so my colleague, Dr. Christopher Snowdon at the IEA, writes a lot about these particular issues and sort of all encompasses them as nanny state issues. Now, if you'd like a copy of Nanny State Index, you can find one just outside next to the beers. I wonder which one of those will be more popular. And what's really interesting about nanny state policies in themselves is there seem to be these two particular arguments. So firstly, there is the moral argument, this idea that actually people should be responsible and should be allowed to take responsibility for their own healthcare and indeed their own health. So that comes both in the systems changes that Sebastian was talking about, that actually it should be up to patients to decide where they get their healthcare from and be able to mold the kind of healthcare choices that they make, and indeed in lifestyle choices like drinking, taking away those kind of products isn't going to solve that problem from a moral perspective. These adults should be allowed to do as they wish with their own bodies and their own lives. And then there is also this secondary point, the kind of consequences to these policies, right? So that actually, if we are to be taking away these products or banning them, or indeed treating industry as though they are just evil and don't necessarily care at all about their consumers, then what you end up doing is actually taking away those choices, but also end up giving it to the black market and end up giving it to those particular industries without it being regulated in the private sector at all. So, Julian, I wondered if you could touch on this a little bit. So what does this actually look like for industry on the ground in reality? And why is it so important that actually industry are being included in those conversations about public health?
So, I mean, David talked about this concept of commercial determinants of health, which is a concept that has been pushed by certain parts of the WHO in recent years, and by the WHO as a sort of confederal organization. It has regional offices. The most active in this space actually is WHO Euro, which is based in Copenhagen. And I think, and what's the origins of this is interesting, I think. I mean, there isn't some great conspiracy, but the WHO is a rather old school 20th century intergovernmental organization. It's the stakeholders that it understands are member states. It doesn't really do multi-stakeholder. It's never been very good at talking to the private sector. When I was ambassador in Geneva during the pandemic, I had to fight quite hard to prevent a sort of coalition of these international organizations with the WHO leading, trying to change the business model of the pharma industry in order to change its IP system. And we and a few other countries that actually have a pharma industry and understand how it works said, if you do that, you are not going to get the vaccines that are going to save the world. So just leave the IP system alone. But you have, the WHO is, I think, by its nature, made up of very good people who have very little private sector experience, and they do worry about conflicts of interest, and they let that get in the way of the fact that actually by mobilizing these powerful global sectors, you can really deliver results, whether it's in the pandemic or whether it's mobilizing the drinks industry or the food industry within an international framework whereby those private sector solutions, those private sector resources help deliver those public goods. Now, every industry used to come through and see me in Geneva, and they'd just been to see the WHO, and they say, why doesn't the WHO want to talk to us? And I'd give them the same answer, which is, I'm afraid that's just the way the WHO is. If you want to have impact with the WHO, you need to talk to the member states, because the WHO does ultimately live under a mandate set by the member states. So that's, I'm afraid that's how we're having to engage in order to make sure the chief regulator in global public health does actually listen to the private sector. But I came from a government that did believe that the private sector, yes, they can be part of the problem, but they also are an absolutely powerful part of the solution within a proper framework that mobilizes those resources.
I think a really good example of that actually is with the tobacco industry. We forget that actually a lot of, and again, we mentioned this, the tobacco industry as an example of an industry that has been completely disregarded in all public health questions and all public health discussions. But actually, it's many of those industries that actually are producing the products that are getting people away from combustible cigarettes. So, for example, if the only country in all of Europe that's actually been able to achieve what we might call smoke-free, I think that we call it a smoking rate that's below 5% is Sweden. They've not done that by these sort of interventionist nanny-state measures. They've not banned tobacco. They've not significantly increased the taxes on those kind of products. But instead, they've allowed adults to make safer and healthier choices to products like snus, which is incredibly popular and has meant that they've been the only country that's been able to achieve what we call smoke-free. So I think it's interesting, even if we just look at that particular example as an industry, the industry itself is the very, very people that are actually producing the products that are helping people get away from the harmful product. I was going to say, David, do you think you could talk a little bit more about what this looks like from an industry perspective, in that, you said this entire idea that actually as a consumer, you might tend to want to shift the blame on the industry. But actually, on the flip side, as a consumer, I liked the title of your article, What Made Me Fat. I think what's interesting about that in itself is it's absolving responsibility from individuals and from consumers. Why is it important that consumers then take that kind of responsibility for their own health? And why is it actually imperative from a moral perspective, but also from a public health perspective?
Well, I'm taking the industry perspective, not the
consumer perspective.
Yeah. Oh, okay. No, I think first of all, also in Sweden, cancer rates are much lower as well. So it's not just a question of people replacing one product with another.
Well, that's because those products are significantly healthier, right? Snus is more than 95% less harmful than combustible cigarettes.
Yeah, and I think that's one of the important things too, is people will look for harm reduction. People understand how to lower risks and how to lower their own risks as well. It's, so people are taking alcohol-free beer if they choose. They're choosing to make their own decisions. But unfortunately, a lot of times they're not trusted. And they're not trusted because there's always a small minority somewhere that's going to either abuse it. There's also maybe a few companies somewhere that abuse the public trust, I should say. And so the regulator comes in to decide that they will be able to make the decision for them. And we used to have signs like handle with care or keep out of reach of children. I don't know if you see these things anymore, but the whole point here is people don't determine anymore what is a risk that can be managed. And that's something that's a very natural thing. When a child learns to walk, they put their hands up in the air because they're expecting to fall. But now we have the precautionary principle, which is hazard-based, which means that we cannot trust any exposure to anything that might be considered a hazard. Therefore, it's no longer for me to decide whether this product is safe and how I should be able to use this cleaning product. We have to make sure that even if I don't know how to use it, it won't cause me harm, which takes a lot of very effective, very useful products off the market. And of course, we get into this problem that we can no longer be trusted. We suddenly decide then that someone else is going to make decisions for us. I used the word one time during the pandemic, we've become docilians. We're docile. We basically have other people making decisions for us that are going to affect our lives.
David, on that particular point, do you think the pandemic itself and the way in which all member states effectively, most member states across the European Union, the way that they reacted to the lockdowns, do you think that psychologically as a consumer that's affected the way in which people decide what they want in terms of healthcare policy? I'm not sure about the stats across the European Union, but in the UK certainly these kind of nanny state lifestyle regulatory measures are incredibly popular when we're looking at it across most polls. Do you think that's had an impact on the kind of psychology behind lifestyle issues?
You see my body language change. I was screaming nonstop. In fact, I somehow worried that I was getting a little bit a fanatic during the lockdowns. We had governments that no longer knew how to manage a risk. We had 3 months before the discovery of the virus till it came to Europe, and we did nothing. We were having football matches in Lyon between the Italians and the French. So we had no sense of risk management even at the government level. All we knew, there's only one tool that they use, and that's precaution. Lock everyone down till it's safe. Don't let anyone out. And by the way, we'll put the old people and the vulnerable people with the people that have no risk. And so you begin to realize just how stupid our leaders were. I was asking basically that the new commission should do a white paper on risk management. We have to understand how to manage risks again. We've lost it.
It's really interesting. And Sebastian, on healthcare reform in particular, of course, you're thinking about the Polish case as well. The fact that we don't have those kind of competitive healthcare models in countries like Poland and indeed in many member states as well, why do you think that competition between healthcare providers, as you described in your initial remarks, would actually solve a lot of those particular problems in terms of the healthcare outcomes?
All right, you're asking that question to a person that dedicated a lot of his life to promoting free markets and competition. So that's like, I think for most of us, the answer is obvious. The competition is good and competition creates high quality products. And why should it be different when it comes to healthcare services? There is no reason for that. Though, of course, people in favor of state healthcare would say, yeah, this is an example of market failure where the market cannot deliver the public good, which is the claim so absurd given all the obstacles being thrown in the way of markets when it comes to healthcare. This is one of the heaviestly regulated markets of all of them. The involvement of the state is on every phase of this market's functioning. So you really cannot claim credibly that this is an example of market failure. It's like claiming that a person with a chain and balls attached to his leg cannot win a race is a market failure. It's just absurd.
And do you think that individuals are just connecting the idea behind like healthcare reform as a system and actually reducing the risk behind alcohol-related illnesses or indeed any other illness in terms of things that affect lifestyle choices? Do you think then that these kind of competitive models will actually allow adults, when they are making those particular choices, to be more responsible for their own healthcare? Obviously, in most European systems, you're not charged an extra premium for particular lifestyle choices, whereas in a system like Sweden, Singapore, for example, you are charged a higher premium if you, for example, smoke. So, do you think that would you be supportive of having premiums on healthcare systems?
Yeah, well, the current system, as we have here in Poland, actually strips people of the correct or the right incentives when it comes to the prevention, when it comes to the healthy lifestyle. If you introduce competition among insurers, among all the other health service providers, they will seek for the cheapest and at the same time best way to deliver the products, which means that they will also seek for the so-called cheap clients. And they will try to put incentives in place for you to stop heavy drinking, for example, right? I'm not saying that you're a heavy drinker, obviously, but but I can imagine easily that kind of a premiums you would have to pay if you are a heavy drinker to your insurance company. And I don't see anything bad about it. It's quite rational to charge people more when their lifestyle is unhealthy, and less when it's healthy. The problem is that it must be their own choice to choose the specific insurer, right? Right now they're forced into the system that they have no control over.
So you think that if we are charging those particular premiums, there has to be competition between insurers. So sort of a bit more similar to a Singaporean healthcare system in which there are those extra premiums charged for particular lifestyle choices. I think that's fair.
I think that, well, but we have to be very cautious about the Singaporean example. Because while you're raising this, or when you're talking about it, the people from, I would say, the left or interventionists, they would say, well, Singapore is not a model example of a free market healthcare system, by the way, right? So.
Yes, it's the only country I'm aware of that does charge extra premiums. Julian.
So I just want to come back on this issue of risk, because I think this does get to the heart of so much of this. I mean, there was, famously, 10, 20 years ago, people used to say, a glass of red wine a day is actually good for you. And for a long time, people thought that was the case. Now there's quite a lot of well, it's usually the same 3 or 4 scientists actually coming out saying, well, actually, no, the new science shows that actually that's not the case. And in fact, every drop of alcohol increases your risk of getting cancer. And that really frightens people, to be told that every drop, that if you just had 1 glass of red wine a week as a woman, you'd be increasing your risk of breast cancer. People think, well, maybe I should really cut out all glasses of red wine in that case. But that is to miss the point about risk. And what you really need in this debate, which has been so far pretty much absent, certainly absent in the official debate that the WHO has been promoting, is an understanding of risk. There's a very good Cambridge University professor for indeed the public understanding of risk, a guy called Sir David Zaruk, who makes the point that it doesn't really matter one way or the other whether or not a glass of red wine a day is good for you or bad for you, because statistically it is entirely insignificant either way. It's not going to do you any harm. He wouldn't go and say, this is safe for you to drink a couple of drinks a day, but he'd say it'd be wrong to say that it's dangerous to drink a couple of drinks a day. And that's what, that's the point about risk. And the problem with going around saying there's no safe level of alcohol consumption and that 1 drop of alcohol increases your risk of cancer, which is true, but it increases it from one infinitesimal amount to another infinitesimal amount, right? That's not what they tell you. They just tell you it increases your risk of cancer. And that plays into people's fears of the story about tobacco and makes people more susceptible, thinking, well, if that's the case, then we need policies like we dealt with tobacco. And that's the risk. Instead of having evidence-based policy making based on a sophisticated understanding of risk and informing the public of what those risks are, you have policies that end up being counterproductive because they affect people who are, they affect moderate drinkers who think, okay, I'm going to stop drinking. They have almost no impact on the people who are drinking harmfully because those people have a problem with drinking. So you have policies that reduce the form of drinking that doesn't actually have any impact really on public health, with no impact on the people that where it does have an impact on their health. So it's not just not evidence-based, but it's also ineffective.
It's very interesting. I think also just from that point about risk in itself, risk is of course only applicable or only relevant if people are able to take responsibility for their own health and lifestyle choices. David?
Yeah, if I can just add to Julian's point there, risk equals hazard times exposure. Okay. Now, what that means is dose makes a poison. The greater the exposure, the greater the risk you're putting out if you're exposed to a hazard. We are turning now into a hazard-based approach when any exposure is going to cause problems. At the same time, we're, as a population, I think we're getting more and more numerically illiterate. I buy a lottery ticket to pay off my credit card debt, so I don't really understand numbers. And so if someone tells me this is something dangerous for you, I think, oh, okay, you can give me the numbers all you want, it doesn't matter. All I remember from that is dangerous, stay away. On top of that, we have another problem too, and that's, I think Julian touched on just a bit there, the scientific community as well has changed and evolved over the last few decades. And it's also tied to the changes in the publishing. We used to think that a scientist would gather evidence and make a conclusion. Okay, and that's our general view of what a scientist should do. Now we have something that I would call an activist scientist who starts with a conclusion and looks for the evidence. And you see the publications, they have grant money that has to more or less come out with a paper, and so they have to publish somewhere. It doesn't matter if it's a pay-to-play journal somewhere, but just to justify all the grant funding that's going along. And these scientists, a lot of them are quite politicized and politically active, and we're beginning to see more and more how they're playing a role in a lot of these debates, as Julian mentions about, any dose of anything is going to be a problem for you. There's this place, it's called the Ramazzini Institute in Italy. I refer to it as a Rotary Club for activist scientists, mainly American retired toxicologists. They meet once a year in Italy near Bologna. And they're the ones who are getting together and deciding. It started with asbestos, but then glyphosate came out of Ramazzini, recently aspartame as well in the campaigns, well, obviously vaping as well. And these scientists all are in a special club. They peer review their own papers. They send people to IARD, the International Agency for Research on Cancer, to determine what is going to be considered as a danger that their friends in the tort law industry in the US can then sue industry out of business. So you begin to see the scientific community itself, and these are the scientists that the WHO is surrounding themselves with, are becoming quite active and not very scientific anymore.
Let me jump in with one thing to support actually what you're saying. There was this famous research by Professor Ioannidis from about 20 years ago that said that 80% of medical research is eventually being proven false. 80%. That's just amazing rate of failure in that branch of science.
And I think also highlights the importance of effectively having principled-based policymaking as opposed to what we might call evidence-based policymaking. What's interesting about evidence-based policymaking, I think, is politicians will often pick the policy they want, and often when it comes to nanny-state issues, it looks a lot better if they are intervening. It looks like they're doing something. Look, I'm saving alcohol-related illnesses by introducing minimum pricing, and they pick the policy, and then they find the evidence that supports the policy they want before they've already picked it. So I think that's what's interesting about that. Before we move on to questions and move on to the audience and hear from all of you wonderful people, just a final question to all of you I'm going to ask. When it comes to evidence-based policymaking, and by the way, if you are interested in evidence-based policymaking, I'd encourage all of you to check out the Epicenter publication on that. You can check that out on the website. When it comes to evidence-based policy making, what is it you actually want to see from institutions like the European Union and the World Health Organization? Let's start with you, Sebastian.
Yeah. Can you please repeat the last question? Because I turned
That's okay.
my brain for a moment.
That's okay.
Sorry.
Brain sometimes turns off. When it comes to evidence-based policy making, what is it you want to see from organizations like the European Union and the World Health Organization?
Well, I would say I don't want those organizations to run my country's healthcare. So I don't want anything from them, to be honest. If we treat seriously, if I treat seriously what I say, so the final goal is to privatize a lot of healthcare system, you need to go for the private solutions. And I believe that private companies are incentivized just because of the fact that they are profit-driven to use the best science possible when they are creating their own companies' policies and their own strategies and their products and so on and so on. So really, we don't need Brussels or WHO to tell us what is good science, what is a bad science. That's, I think, totally unnecessary.
Excellent. So we want the evidence effectively shows, according to Sebastian, that the government across all member states should take a step back. Julian.
I would like the WHO to use its own evidence. I mean, the WHO's published a very comprehensive report that came out in June, which actually was looking at this issue of how are we all doing around the world in terms of tackling this harmful consumption of alcohol, in terms of the key UN indicators for measuring that. And one of them, the most significant one is, alcohol-related mortality. And they did a comprehensive report. No one else could have pulled it together, although there are some institutes that do a very good job in this area. But this is the official UN data produced by the World Health Organization, country by country, over a time period, which showed that since 2010, alcohol-related mortality has fallen by 20%. And that's an extraordinary progress. I mean, in any other area of public health, if you saw that sort of progress since 2010, you would be saying, this is...
Let's do more of that, yeah.
What's working? But you wouldn't know that this data has been collected by the WHO, or indeed that this is what it says, because the WHO doesn't talk about it. They don't talk about it at all. They talk about there's no safe level of consumption. They talk about commercial determinants of health, excluding the industry. They intimate, without saying it explicitly because it's not true, that the current strategy to tackle the harmful use of alcohol through a whole of society approach that involves the private sector is not working and needs to change. So we'd like them to use their own evidence. We'd like to look at that evidence country by country. We'd like to understand what is working, because I don't think actually anyone's really studied that properly. And then let's reinforce what's working. And that is what we in IARD will be supporting and our companies will be supporting.
Excellent. World Health Organization, look at your own evidence.
I think listening to a wide range of scientific advice is useful. In the US, for example, when they were looking at the opioid crisis, they only interviewed scientists who were experts in addiction, not pain management. During COVID, we only listened to virologists. We didn't listen to epidemiologists. So you have to look at a wide variety. During the Green Deal, the European Union didn't even listen to its own JRC, the Joint Research Center. So I think that's the first point. Get a wide body of scientists, including industry scientists. Industry scientists are not, industry hires the best scientists out of school. They give them the best research facilities and they give them the best opportunities. And yet, if you look at something like food additives, there's very little research being done outside of industry. So where are we getting all of this advice from? And I think that WHO, unfortunately, only listens to advice that they have certain restrictions of whom they can listen to. I'm actually working on a project to try to set up something called a WHO Watch, where you have a wide variety of scientists who can actually speak up when the WHO is saying something stupid like they did in the CDOH.
Excellent. Thank you so much. You've all been absolutely wonderful. We've got just over 15 minutes left. Let's see how many hands up we have for questions. Let's go over here at the front.
So first of all, thank you so much for this wonderful panel. I wanted to, so first of all, it's going to be mostly for Julian as an insider, but I'll start with a bit of a background. So in Poland, there were two fairly major public outcries recently, both related to alcohol. One being very heavy discounts and one of like the biggest Polish small like a convenience store called Żabka, that you had very big discounts for a lot of alcohol and usually even stronger alcohol to make it very cheap. And the second one was related to it also in Żabkas, interestingly. It was called Alco Tubes, which was a like Capri Sun-esque, like fruit mousse looking tube that was alcohol basically. And both of these sort of reinforced a public understanding that alcohol producing companies are basically, their whole model is to get you hooked on alcohol, make you an alcoholic and have you spend your life's worth on alcohol. And hearing from you with regards to the importance of the health aspect, and of course we don't want the society to become alcoholics, I'm wondering what is the industry's view in terms of the economics of alcohol, and especially in the context of the non-alcoholic drinks, which are becoming more and more prevalent, which is great. Do you more intend to lower harm as a point of good nature or as a economic benefit? What is there to be earned from that, and what are the motivations behind it, and how does that relate to the public outcries that we've seen and the approaches that were exhibited there?
Amazing. Julian?
So thank you for the question. I mean, IARD is made up of only 13 companies, and there are many, many, many companies in this industry. What we believe, my members believe, is that we do represent the highest standards in this industry, and we hope through IARD to be setting them and to be, because of the global reach of these companies, driving those standards globally. And we do think that is a role that the private sector can play. I mean, global corporations are nobody's friends. Nobody sheds a tear for a global corporation. But what they can do is they can drive global standards, and IARD does that. Now, I don't know the details of the Polish situation. I'm fairly confident that none of my companies were involved in what happened here, and I certainly don't. I mean, from what you're telling me, that's not something that any of my companies would condone, and they certainly, whoever was doing this, certainly wouldn't be a member of IARD. And we do think that is a role that these companies can play, is helping when they do. I mean, there has been quite a lot of consolidation in the industry. That's not popular often because it means small companies, local companies get bought up by these big international companies, and that's not a popular decision. But what it can do is it can mean that they're then brought into a company that has corporate standards and has standards about how it markets, which we have, and that can then bring progress in terms of what's going on sometimes where things are happening that none of my companies would condone, and IARD certainly wouldn't condone.
Does anybody else want to come in on that question, or should we go back to the...
Just very quickly, we need regulations, obviously. In a case like this, that would make sense. But regulations, though, have to be reasonable. Otherwise, you get what I would call the Al Caponeization of industry. If you have an irrational regulation, you're inviting people to break the law or push the boundaries.
Amazing. Let's go back to the audience. How many other questions do we have? Hands up, hands up. Yeah, let's go here to the front.
So my question is, speaking insurance-wise, if the insurance system was to be made private, and the companies would need to implement, those statements of people, for example, they would need to say what are their habits, how much are they drinking, how much are they smoking, How would the insurance companies ensure that or verify that? Wouldn't it only lead to even more control put on individuals? Because that's how I see it somehow.
Mm-hmm.
Sebastian?
Yeah, we all have Facebook, right, and Gmail. So I think it's already there. We already gave this information to the industry. So let's use this information in a good way, I would say. For a company to track your habits is the easiest of all the jobs or the task it can perform. It's very easy. And it doesn't have to be like specifically there is this person at the company knowing that you are drinking too much. It can be algorithm deciding and using those data in an anonymized way. So it doesn't have to be a threat to your privacy. in a way that somebody can use it against you. So yeah, that's my answer.
Interesting. Did anybody else want to come in on that? Any other questions from the audience? Ooh, silent. Interesting. Okay, I'll go back to questions. I think what's interesting from this particular perspective around just connecting these two kind of broad topics together. So we've spoken a lot about risk, a lot about evidence-based policy making, and then from Sebastian, I've heard a lot about what an ideal healthcare system could look like. How do we actually think the industry and these healthcare insurance companies in this kind of ideal free market healthcare system would interact with one another? Sebastian.
I don't know. It's up for the market to decide. So I'm not trying to put out a vision of an ideal system, because the market is a process. It's a never-ending endeavor, right, of all of us, of consumers and producers. So there's no way you can tell that ex ante. You need to wait. You need to let the market work, and then you'll see what's the not ideal but optimal solution for the specific point of time.
Julian.
So, I mean, my perspective on this isn't really based on my current role, but on my previous role, and it does reflect the fact that I was a British public servant for a very long time, and in dealing in particular with global public health. And one of the things, though, and the UK has a very thriving private sector when it comes to pharmaceutical companies and the like, and they're obviously critical. They're absolutely critical to the development of innovations and solutions to our health care problems. So, the role of the private sector is absolutely front and center in terms of the UK government's view of how you deal with health and healthcare, and how you innovate, and how you solve global problems rapidly by mobilizing massive resources like we did during the pandemic. If it hadn't been for those companies, we would not be here today. Those companies did something that actually at the beginning nobody thought could happen, which is not just produce one viable vaccine, but I think it was 5 within the year. And that's extraordinary. And that was because they threw billions at the problem. And they worked with regulators to fast track the testing processes in order to get those vaccines out and into people, so that we were able to end the lockdowns and put vaccines in place globally to deal with that. But we don't think, British government anyway, doesn't think that the private sector in healthcare should be given complete freedom, because there's an example, and we came under pressure in the UN to do this. There was a movement pushed by some parts of the international private sector to try and get the UK to open up its NHS procurement system. Now, by procuring as the whole of England, we are able to get a very good bargain for British consumers of pharmaceuticals. Now, the pharmaceutical companies do not like that. They would love it to be fragmented, and they would then be able to get a better deal for them, but a worse deal for the British public. So, this is an area where I think from the British government's perspective, and that's true whether it's a Labour government or a Conservative government, it's not something you completely open up to the free market. But without policies that support those industries that have been absolutely critical to developing the innovations that have literally saved us, you would not get, we'd not be here today. I think it's as simple as that.
If I can touch on, well, there's 2 discussions going on here, I think, at the moment. The innovations from industry, but also the healthcare approach, if I can address both of them. Growing up in Canada, we had a health system much like the NHS, which was completely public, which meant you never had to pay for any medical services, but you also had to wait a long time. And I'm assuming this is the debate that's going on here now. We looked south to the border, and it was completely private at the time, which meant that if you had money, you didn't die. Okay, and we looked at that as well as far less efficient financially and expensive, except that you actually had advances in health. I moved to Belgium, and they have a public-private system, which means that the health insurers are, in a way, private and competing, and the tied to political groups as well. But at the same time, the government would bail them out if they ever went too deep into the red. So I think there are three models there, and I think Poland has to choose for that. Just to add on Julian's point about the 5 vaccines that came out. In the 90s, when I was working for the chemical industry, they started with something called combinatorial chemistry, which means you could, instead of manually choosing molecules to see what would happen, you could just put them through an automated system. And a lot of the advances in medicine that came out in the late 90s, early 2000s happened because of the new technologies for identifying the chemistries that could lead to the new solutions. Now we have mRNA approaches, and you begin to realize now, once again, the private sector is beginning to start to discover the applications where we can start to vaccinate against cancers. We can start to vaccinate against other potential diseases well in advance. And so we have to look at these opportunities and get behind them, and not sort of treat industry like some organization, mafia that wants to make us sick all the time.
I think it's also important to note that there aren't just 2 models of healthcare systems in the world, and that actually we're looking at different countries across Europe. Actually, there are so many different variations. I think what's interesting about healthcare system failure, and I want to bring Sebastian in on this, countries like the Netherlands, for example, where there was this question about whether or not they would begin to bail out healthcare providers when they began to liberalise their system, and they decided that they wouldn't. And it meant that, yes, sometimes healthcare providers would fail. And that is an example of the market working, because those particular companies were not able to provide their best systems for consumers, and they weren't able to become profitable. I think what's interesting, Sebastian, I thought would bring you in on this particular discussion around those particular healthcare systems as well. Do you think that those competitive models actually then solve a lot of those problems?
Yeah, I think so. I mean, I'm sure of it. What I saw, just to answer a bit away from your question, but I think that this example could be useful in understanding how bad is this pro-regulation approach when you ban everything that is considered to be unsafe. I think everybody or every one of you knows of superchargers, or this is how we called it in Poland, dopalacze. So these are those substances, drug-like substances, that were introduced in the market in New Zealand for the first time in the history 20-something years ago by a guy who wanted people to have a low side effect drug to have fun in clubs. And really it was of low side effects, because you have to know that drugs are not the same. And people were using it widely in New Zealand. He made millions out of it. But then some conservative parties said, well, we cannot allow our youth to do it, to take this drug. So they banned specifically this substance. And then the guy said, well, I'm already a millionaire. I don't want to play anymore in this game. So he just stopped producing it. But guess what? There were many other people who thought, well, this is a great market. We need to do a slight modification of the original drug and introduce it back to the market, because it's not banned yet. So they started to play cat and mouse with the government, trying to avoid the new, these bans, which led to the fact that the product was becoming more and more dangerous for the people. And now what we have in Poland is a just side effect of what happened in New Zealand 20-something years ago, because we have this problem that there are substances you can buy on the internet, and they are literally killing you instantly.
Final thoughts from David and Julian, then we're going to wrap up.
Well, just to add to your point, if you ban something, you create a market for something else. In Canada, when I was growing up, alcohol was very difficult to get, but I could get drugs in the back of the schoolyard, no problem at all. And today we're beginning to see how we're liberalizing a lot of drugs that maybe we shouldn't, particularly to see in countries where they've started to liberalize the drug market and tighten up other markets, and we're having consequences.
Amazing. And Julian, final words.
So thank you. I think what I'd say is that I think in so many areas, actually giving people information so that they can make their own choices, informed choices, is the way to handle these issues. And that includes making sure people actually understand risk as well, and that if we focused on that, we would have much better outcomes, including in the area that I'm now responsible for, rather than just regulating in a way that actually drives the problem elsewhere in the ways that we've been describing.
Amazing. Well, thank you all so much for joining us this evening, so late on a Sunday. Thank you. And thank you to my wonderful panel. Oh, 5 seconds left, just on time. We've got excellent discussions across outside, and of course we've got the research on the tables if you'd like to pick it up. And I think there's some beer left over as well. Thank you.
Jedzą kanapki z kawiorem.
Nadzwyczajna kasa.
Obrażanie dziennikarz telewizji polskiej.
Chodzi o działania polityczne.
Ratowanie ofiar dla pedofilów.
Für Deutschland.
TVP Info. Włącz się na nowo.
Radość, nadzieja, życie, wyzwanie, pasja, pamięć, zaufanie, pokój, jedność. Słowa tworzą świat. Polskie Radio. Źródło wiarygodnych informacji.
Plany biznesowe powstają z marzeń. Dlatego nie ma dwóch takich samych firm. Jedni chcą działać na całym świecie. Innym cały świat mieści się w dłoni. Sukces biznesu to nie tylko jego wielkość, ale też szczęście, jakie przynosi ludziom. PKO Bank Polski.
Uwielbiam szycie w sieci. Wczoraj podszyłem się pod wnuczka, wieczorem uszyłem intrygę na apce randkowej, a dziś planuję grubymi nićmi szyte oszustwo z promocją. Tak się szyje.
Na oszustów są sposoby. Zapoznaj się z poradami ekspertów na niedajsiepodszyć.pl.
It's not always easy to recognize. It may look like this, or like this. It may be a burden, but it is a responsibility that we embrace nonetheless. But if it means this for one person and this for someone else, maybe it ultimately means being there for one another. It isn't handed to us, but we know where to find it. And how it feels, how it tastes, and what it sounds like when we finally have it. It means different things to different people, but for many, it means everything. And if we all fight for it, it will eventually bring us together.
Ausreise.
Polskie Radio.
Jedynka.
Rodzina spółek Pelion to 12 000 osób pracujących w ponad 300 spółkach w Polsce, Szwecji, Wielkiej Brytanii i na Litwie. Jesteśmy liderem w branży ochrony zdrowia. Od 1990 roku dbamy o długość i jakość życia. Pracować z nami możesz w jednym z 7 obszarów.
Zapraszamy do Trójki. Od nowa.
Trójka. Program Trzeci Polskiego Radia.
Czy wytrzymasz klockowe tortury ze stoickim spokojem? Czy w twardych negocjacjach zachowasz zimną krew? Czy poddasz się dobrowolnej eksmisji ze swojego łóżka? Brawo! Test na obecność serca zaliczony. To znaczy, że ty też możesz być rodzicem zastępczym. Dowiedz się jak na testserca.pl.